All right.
Welcome. Oh, yeah.
No, you go right ahead. Go right ahead.
No. I was just pulling your leg. Go ahead.
Circuit World in downtown Blue Ridge. It is now time for Ask the Doc with Dr. William Whaley and Raymond Tidman. Maybe there's a new viewer. So this is Dr. Whaley and this is Dr. Raymond Tidman. We always have new viewers. I hear that all the time. I was down at the Georgia State Capitol all day Monday, and, there's people come up to me and say, oh, I like Ask the Doc. I'm like, okay. Anyhow, I want to thank Georgia Cancer Specialist, Northside Hospital Cancer Institute for our segment. How are you today?
Fine, and I got something to say.
No.
Yeah.
We got something to say.
We got the truck out there because we're at Circuit World.
Right.
By the way, there's a supply chain problem. We don't have quite as many washing machines as we would expect. We got the right number of television sets over here. But anyway, so we're at Circuit World, and it is sunny out there.
Yes.
And there's my Rush Limbaugh spring tie. But it's going to be 21 degrees or something tomorrow, and they say it's going to snow. They say it's going to snow. So welcome to the mountains, folks.
Can I?
Go ahead. Yeah, you can say something too.
Yeah, I'd like to just jump in here. I was in Atlanta last week also.
Okay.
I went to the Eagles concert. You've never seen so many old people in your life.
And nobody.
I have no idea how those old people got in there.
You don't know how all the old people
But
got
it was a good concert.
Good concert. Eagle
If
concert.
you get a chance, live music, support your live musicians.
Yeah.
And you went.
And they are live. They're still live. Some of them don't look it.
Oh, they look fine. Come on now.
Joe Walsh is looking pretty rough.
As good as we
so
look.
Joe's looking pretty rough.
Yeah.
Okay, so over here we had a weather report for you, and over here we had a concert update. Now we have two questions.
All right. So this I got. This first question is extremely important. We're going to take it up to a couple levels beyond where it was written because it has so much to do today with what's going on with COVID and so forth. This is what we call a survivorship question. My wife is now 57 years old, and she had triple negative breast cancer 7 years ago. Now, you remember that triple negative is the real aggressive one, and we treat it with chemo before the surgery and all that. The question doesn't say it, but we had triple positive last week. Remember, that it's easy to treat. And she had what they called chemo brain for 19 months after completing chemotherapy and radiation to her chest. They said it would clear by 6 months, but it took longer. She and I both think she still had a bit of it after that period, but she was a runner, bank loan officer, and obviously recovered well. In November, she had a significant case of COVID during the Delta variant epidemic.
This is very interesting.
She was COVID vaccinated and boosted because of her breast cancer treatment, and she had antibodies. Well, that was the right thing to do. She'd had big time chemo, big time radiation. So I guess her PCP got her immunized, and then he checked her antibodies, and you have antibodies. Didn't protect her from the Delta variant, but anyways, he'd done what she was supposed to do. All right. And she now has what the oncologist, we are still seeing him yearly, says is clearly COVID long hauler cognitive dysfunction. And he says it's just like the chemo brain. She has returned to work, but not to running due to fatigue. Do you have any suggestions or thoughts? Well,
I do.
Yeah.
Well, they asked if I had. I have thoughts.
Yeah.
Before you get into this, I did not. I think it was at 4:00 this morning. I'm scanning through, and there's an article of how COVID affects the brain.
Yeah, in their news this week.
Right.
Well, before even going there, tell the audience what quote chemo brain was.
And that was my second thing. Could you, because she put it in bold, what is chemo brain?
Now, that's where we're going to start.
Yeah.
Because the chemo brain, put up that first chemo brain sign there. You're going to go back now about 20 years or so. We began to learn that there are side effects of treatment when you cured somebody of cancer or control of the cancer that can occur much later. And we had a case here last week or the week before about 35 years after a woman had had radiation for Hodgkin's disease, that she had breast cancer because that radiation increased her chances of breast cancer, and we were discussing her breast cancer. So these are all called survivorship questions. Early on, when we started giving aggressive chemotherapy, particularly for triple-negative breast cancer, people began to say, I'm having trouble remembering and stuff during the chemotherapy. And people poo-pooed it. Have you got that first one up there? All right, what does that say? Look at it. Can people read that? It says, chemo brain, is it all in your head? All right, take that down. Now,
If you got brain somewhere else, you got a problem.
well, no, but what that implied was, is this like chronic fatigue or some of those things that may not be real? So here is the where we go. Okay, here is the straight scoop on chemo brain. I'm just going to read things. First of all, a huge study where you've got a big group of patients, women and men that have taken chemotherapy for breast cancer, that are compared to their significant others, feeling then that the ages are going to be roughly the same, educational background is going to be the same, and that's a comparable group of people. So they have 1,000 patients and 1,000 controls, and 37% of patients, 6 months after they had concluded chemotherapy, reported a decline in cognitive function relative to pre-treatment, where 14% of the controls did. So if you just take a normal group of people and ask them 6 months or a year after you first talked to them, are you as sharp as you were? Well, 14%, no, I'm not quite as sharp as I was. So here's what they discovered when they began looking into this, that the higher risk of the decline were people who had had fatigue, anxiety, or depression before they got chemotherapy. Well, that kind of says, it's sort of like the chronic fatigue, doesn't it? That they also had decreased cognitive reserve. What does that mean? I'm going to tell you about that in a minute. And a decrease in functional well-being. So it tended to be sort of older people that had some age-related calculation or mental problems, or processing speeds and so forth, like you do with airline pilots and athletes, when compared to the group that didn't have chemotherapy. So this is a demonstrable decrease in function. This is a reported decrease in function in 37% of people greater than 6 months after chemo. Now you go back to this question. She had it during chemo, so that's real. You're getting chemo every week, you're getting steroids every week. It's going to affect your brain. And they had told her it should be gone by 6 months. So that's why this study started at 6 months. All that kind of acute chemo brain should have sort of been gone by then. So that's the logic behind it. Okay, so put up the next one. So this is the chemo brain that links this entirely to breast cancer, and this is science. This is not saying, look, you're depressed and you came in here depressed and you went depressed. Go to the next one. This is just kind of a quick look at what I think some of the mechanisms might be. You remember that I've said that there's a blood-brain barrier, that when you are sick with the flu and puking and everything, your brain doesn't get sick. Now that blood-brain, you can pull that down because people get confused about the brain there. So you can give people morphine and it quickly passes the blood-brain barrier, right? Because it relieves pain. But chemotherapy drugs generally don't cross the blood-brain barrier. So there is some thought that there is at the blood-brain barrier something the chemo may be doing. Now this is beautiful. Show those beautiful pictures with all the blue and the yellow and everything. What are these? These are functional MRIs where you give different chemicals and then you watch what happens. There are actual demonstrative changes in the functional MRI in patients who have the chemo brain. We're going to define how they find it in a minute, when compared to the control. So pull that one down. So this is a real You can see it on a scan. It's not a joke. So now let's go to the next. Don't put that next one up now. You remember I mentioned before that the first team in the National Hockey League to have a brain concussion protocol was the Thrashers. And we took the test that we were using in aviation medicine. Remember, I was at Delta then, and the airline pilots had to retire at age 60. They wanted to go longer, and the FAA said, well, their cognitive ability probably goes away after age 60. So they developed a test called Cog Screen that could be given to pilots that spoke English. And then if you tested those pilots in their 50s and they were as good or better in their 60s, then they should be able to fly longer. All right? So that's how they raised the age to 65. But the interesting question was, what if at age 50, this guy is way below these other guys that are 60? So you have to be able to compare him to himself. So we developed for Russians and everybody who couldn't speak English and could speak English, psychological testing that tested their ability for rapid eye movements and so forth, given to them when they came into the National Hockey League. And then when they got banged in the head, if they had a real concussion, they could not go back to playing until they could take that same test compared against themselves and be within one standard deviation of their baseline. You got it?
So it's important to say that they're comparing themselves to themselves.
Correct.
Not to some group.
That's it.
Right.
Themselves. That's why I say you don't want to take anybody and compare them to Michael Jordan, because they ain't going to make it.
Right.
Compare them to themselves. All right, now, so put up this next one. So this is a study taking cognitive testing to a pretty high level that like we do with athletes in NFL, NHL who've been hit and have to go back to play and then have to have a sophisticated test. It's as sophisticated as the one that's given to airline pilots who have had a concussion or have had some sort of a thing that you don't want them going back to work until you've proven that they're safe. Okay, pull that one down. So this is the part, don't put the next one up. So when you see a guy come off the field in a hockey game or a NFL game and go into the tent, and then they say he's in the concussion protocol, and he comes back and he plays, and another guy, they say he's out, and will be out for the rest of the game. So what do they do to him in that tent that says this guy can go back and the other guy can't? Well, it's common. We do it in our office every day. I had a patient yesterday, he's forgetting everything. I say, look, I'm going to give you a memory test. I want you to remember bell, book, and orange. Bell like a doorbell, book like you're reading a book, a checkbook, and orange, the color of the fruit. 10 minutes, I'm going to ask you that again. Then you do your physical examination, you talk to them, you say, now what were those three things I asked you to remember?
Bell, book, and orange.
Bell, book, and orange. Well, if they can't remember...
I don't want 10 minutes to pass.
Can remember one. If they can remember 1, 0, or 2, they aren't quite all there.
Right.
Because you ask the people that accompanied them, you remember as well, but don't answer the question for him when I ask him back. So that's what they're doing on the sideline, is something quick like that. One, it's balance and finger to nose and stuff like that. It's not the big test. So now we're back. You can put that next one up now. So basically what you would do clinically for somebody to find out if they had chemo brain is just ask this kind of questions, simple recall things, and some, the primary care doctors do it all the time when they do the dementia test. Yeah, all right. But when you want to really define this, you've got these you can pull that down. Like that MRI right there probably costs $20,000 to do. So you don't do that clinically. You do that in the research about it, and then you try and convert that into what are these simple tests we can do. All right, so this chemo brain then is associated with a decrease in the ability to do rapid movements or learn. You don't do remember I said the marijuana made you where you couldn't balance your checkbook? You don't do quite as well with simple functions, balancing the checkbook and that sort of stuff. And it can last for in theory, it should be gone at 6 months if it's due to the drugs and the pre-meds and the steroids. Now, if it's real structural and related to something that's gone on in the brain, and it's going to last longer. And this study all begins at 6 months and shows a sizable proportion of people have it. So this patient had chemo brain. Now she's got something that followed COVID. Put that next one up. We did this early in the COVID epidemic. We talked about, this is the neurological complications of COVID-19. Now, you'll remember early on we were talking about people had clotting, they had the cytokine storm, and when they went in the hospital, you had to give them steroids and anticoagulants. That's how we got the death rate down so fast. They didn't throw these blood clots anymore. They didn't have these huge respiratory
Addressing
things.
clots alone was a humongous lifesaver.
Right. Sure. So anyway, you can pull that now. But this was, what are the neurological complications of acute COVID? And that was seizures, that was coma, that was all sorts of stuff. So the original research about COVID and the brain was, what is happening during this bad set of COVID when the guy got in the hospital? Well, we learned when the guy didn't get in the hospital and he had COVID and he wasn't terribly sick in terms of fever or cough, there was some neurological cognitive problems. All right, put the next one up. Now this is where we are. I'm not going to get into this much, but this is a very, very comprehensive article that studies and reports not only the acute, but the post-acute neurological complications of COVID-19. And I think that's what you were reading in the paper yesterday, because this has been hot. You can pull that down now. This has been hot in the news for about the last 3 or 4 weeks.
Bill, one of the things that the audience needs to understand is that, and you've bounced all around it, is in medicine, if we're going to do a proper job, we need to quantify something. We need to measure it.
Yeah, take your temperature.
But it's a number.
Yeah,
we're trying to assign a number and a value, and then we look at that over time. Your hockey player, okay, he just got his bell rung. Here's his number. 30 minutes later, here's his number. No, he's not going back in the game. He may be out for a month. I mean, you're really, because you're trying to make hard decisions and you're trying to look at a hard and fast number. Now, just saying somebody feels addled, or that's my favorite word.
Yeah, but that's a
favorite
great
country word is addled.
Yeah.
That's not good enough. We need to have numbers like we do a mental status exam, and we score it.
Right.
And we say, hey, your normal score is 30, and you're 22, or LGB, you're 10. Okay, you shouldn't be in the White House. No, I'm digressing here. But we do a mental status exam, and we get their score, and we look at them now. We say, hey, you've lost something here. We look at them 6 months from now, you've lost more. We got to work this up. This is not just, I think I'm being forgetful. We're objectively measuring something
that's right. And that's a lot different from you saying, I don't know where I put my car keys.
Right.
And I said, as a matter of fact, I think it was last week I said, that a real memory disturbance is you can remember your first grade school teacher and you can remember who won the World Series in 1962, but you say, what time is breakfast, and you got scrambled eggs on your shirt. So it's a recent memory thing, not an ancient memory
thing. And we refer to those as executive functions. Are you, it's not just are you misplacing your keys, or can you balance your checkbook, or can you remember a relative's name or not? These high-level executive functions that help us get through our day, we must not lose those, or we're in real trouble.
Yeah, can you make moral judgments?
Right.
I mean, moral judgments are part of executive function. So when you're losing this, you might do something you wouldn't otherwise do. You might drink and drive. Mm-hmm. You might have high-risk sexual behavior or something. Mm-hmm. So anyway, here is my advice. First of all, this is a runner. This is a competitive runner, competitive tennis player, and a bank loan officer. So this is a high-functioning woman.
Who's not old.
And not old. And so she is sharp enough to recognize that it ain't all right. Mm-hmm. And so she's not back to it yet. I don't think we have the foggiest idea, and I hate to say this.
Good choice of a word, foggiest.
I don't think we have the foggiest idea how long some of these COVID things are going to last, because the myocardiopathy, we know it's going to last 18 months now, because we got people that still got it that had the COVID in the first half of the first year. I've got patients today who still have no symptoms, but still have ground glass in their CT and their lung, 6 months ago they were short of breath and had a cough, and it was a year ago that they had COVID. So now, 6 months after the last one, you take another CT. Well, you look good, you feel good, but you still got some visible scarring in your lungs, and it should go away. But we don't know for sure it's going to go away. So my advice here is just let her go back to running as soon as her fatigue's better, because we didn't even mention it, but patients that have COVID can have fatigue for a year. So she's going to get better. She got better from the chemo brain, took her a year or longer, and just keep on keeping on. She'll get better from the COVID. I mean, is that your experience? You see more acute COVID than I do.
Yeah, yes. And to the degree that we can get more objective and better measuring about this, we'll better understand it. But if we have time at the end of the show, I'd like to talk about a head trauma patient I saw this week. So
Okay.
that's interesting.
All right. Well, this second question doesn't.
Hold on just a minute, sir.
Yeah.
Thank you, Georgia Cancer Specialist, affiliated with Northside Hospital Cancer Institute, for allowing us this opportunity to answer these questions and bring these two great doctors every Friday morning. These are amazing questions. I just read these, and they really are. I mean, they're amazing questions that we get to cover. I really don't know of any other segment out there that addresses what we do on Fridays. I can't think of any.
Yeah, I don't either. No, I don't either.
Go ahead,
I think it's fun.
Number two.
All right. Now, this is an important question. It's not going to take long to answer it, because that question we just had was what you call survivorship. All right. What the long-term effects of cancer or anything else. You survived this. Now, what's the rest of this look like?
And the complete thing that a physician does. I'm offering you a treatment. Your odds of surviving this disease are X. The treatment gives you survival of Y with complications Z.
Yeah.
But that last part you talk about.
Yeah.
What are the complications of the treatment? Because that's part of the decision.
Yeah.
That's what I was getting ready to say, is because you just did an X, Y, Z, but at the end of that, it reverts back to the individual's decision.
It's their decision.
And they have the
Being fully
information.
informed.
They're informed on what could happen,
Right.
will happen, and they can make a decision.
And this woman 7 years ago obviously had pretty advanced triple negative breast cancer. So she's a 7-year survivor of what's a bad disease. All right. So this next question, I've said since we started this program, 6 years ago or something, that what's going on in the science of oncology today is not more surgery, more radiation. It is genetic testing, targeted therapies, and this question hits a tiny little slice of lung cancer that we happen to have two good examples of in this community that are living 11 and 12 years after diagnosis of advanced stage 4 lung cancer, and they've never received a chemotherapeutic drug. They've always been treated with targeted therapy. So here's this question. My brother is 50 years old, and 12 months ago, he was diagnosed with stage 4 non-small cell lung cancer, and we discussed this case here. And I asked the question about has gene testing in drivers been done? And we were talking about he was going to get some induction chemotherapy, and I asked the question, now, has he had the drivers done, and do we know? And we didn't have an answer. So we suggested that he do what the doctor said, but ask the question about drivers. So obviously he had the drivers done. He did get tested, and he had the ALK gene, whatever that is, and he has taken a pill for 9 months, and all of his disease has disappeared. Now, you just think about Jimmy Carter. Remember, Jimmy Carter has been now 5 or 6 years, had cancer in his brain, liver, lungs, started the Keytruda drug, hadn't returned, and he's out 5, 6 years. So we have some data on that immune checkpoint inhibitor in the kind of cancer that Jimmy Carter had. So we can't tell you yet how long people might survive, because that data is still being gathered. Now, this is different from that, but it's targeted therapy. Okay, put that next thing up there. This is a timeline, and the reason I show it is because the progress is being made. You got it up there. It's pretty colors, isn't it? All right, these pretty colors. All right, so this is lung cancer. So you go back to the 1940s, and you had nothing you could do except an operation. By the time you get up to the 70s, you have developed new chemotherapeutic drugs, 70s and 80s new chemotherapeutic drugs. And nothing happens till early 2000, and this is where they come up with a bunch of new chemo drugs. The first time you see a targeted therapy is in the middle of the 2010, 2012 range, and then you start getting these immune modulating drugs out here. But look how many new drugs were approved in 2020. That's how far that goes out. About 8 times that many were approved last year. Okay, pull that one down. So that's what all these drugs are about. Now, this is that famous pie chart we see, all these beautiful colors here, but this is all cases of the lung cancer, okay? Now, only that section of the lung cancer, which is less than half, but
And what are you pointing at so the audience knows?
it's that big old
The big wedge.
top, the big wedge, the top half. Says no detection detected. So that's about a third or a little over a third. So 2/3 of these lung cancers have a driver. Well, ALK is that little one right over there. It's only 7%. Pull that down now. So this cancer we're talking about is only 7% of all lung cancers. So here we go. This is a specific drug that hits the ALK receptor alone, and it was released for the treatment of this cancer about 24 months ago. Pull that one down. Now, just to prove to you how complicated all this is you saw there were about 12 different drivers in those little slices there. And this is sort of the metabolism of a cancer cell, and the ALK thing is only this one little bitty spot right down here in the middle. I mean, everything else is the checkpoint inhibitors and everything else. Pull that one down. And this is the genetic sequencing. You don't need to see that either, where the ALK gene sits. Pull that one down. But what I'm trying to show is these things are not simple. It took a whole lot of guys at Georgia Tech, and I say Georgia Tech because Georgia Tech and Emory developed this new oral drug for COVID, and they have a cooperative program that is medical science and engineering science and bioengineering there in some think tank building on 10th Street and Peachtree, where this kind of stuff is thought up. Who do you think thinks this stuff up and makes it happen? It's graduate students. It's guys working on their master's and their PhD, and they got a bunch of students that are majoring in biology or in engineering or bioengineering that are down there doing the grunt work, and then there's some professors up here who are thinking through it. But what came out of this in terms of the COVID was a drug that's worth a couple $2 billion that you can take orally for acute COVID that works. Well, that's where this came from. This came from bioengineers. I think it wasn't at Georgia Tech. But this drug right here is a pill that's got simply no side effects. And if you got that ALK gene, like he said, within 6 months, 100% of the cancer is gone. Well, what was his question? How long can this last? Well, we don't know the answer to that question. But we know that this drug has been on the market for 2 years. And people that had started 2 years ago are still in remission. But I began this segment by saying we have 2 people in this community who are at 11 and a half and 12 years of long-term survival from targeted therapy from lung cancer. And if you went back to that timeline I had out there, the very first targeted therapy came in 2020. Mm-hmm. So that the people we have here had the target that was available in 2020, 2021, and they are still doing well with that pill, and they've never had chemotherapy. So they're not cured. They still got the disease, but they're alive 11 years later, and the life expectancy of stage 4 non-small cell lung cancer is 6 months. So I would encourage your brother to stay with the ALK pill. And if with this first ALK pill he relapses, they got new ones coming along every few weeks. So I'm encouraged by what happened to your brother, and I give his whoever's taking care of him a kudo for having found it so quickly, and to whatever company developed that thing was a bunch of graduate students. So there you got it.
And I'll pat our Georgia program on the back. since we're pretty humble here in Georgia, Georgia Tech Emory's BME program is number 1, number 2 in the country year after year, ever since it was formed. It was started by my advisor and mentor in aerospace engineering, Dr. Don Giddens, now retired, who also went to Johns Hopkins and created their program first, which became number 1. Then he came down
And
to
he
Georgia
got some money from Pete Petit.
Yeah, he did. Well, yeah, he had great
He
sponsors.
has a great people.
He had
Have
great
to,
sponsors,
people
but
have to give him money, don't they?
for one person to create the number 1 and number 2 programs in the country, therefore in the world, is pretty impressive.
Yeah, it's also impressive that he knows how to have fundraise and knows how to give
Yeah, he
speeches.
knew how to do that.
He knows how to organize. He knows how to get good people around him. Yeah. And what's the next thing he gets? He gets the top choice of the graduate students.
He does.
So people want to
And
go
there,
get
as you said, they're the ones that do the real work.
Yeah, well, and even the guys below that are down there boiling the test tubes.
Yeah.
But anyhow, I'm real impressed with that. I'm impressed with this. I'm impressed with the science in that question, and I'm impressed in the first question about the cognitive dysfunction. I'm impressed with how neurobiologists and radiologists have gone to all the trouble, time, and expense for which they do not get reimbursed except by research funds to come up with these functional MRI tests and stuff that really help you figure out how to take care of the average person when it costs $25,000 to do these tests. You don't apply that test. You apply what you learn in that test to something more simple you can use to take care of your patient.
Bill, we frequently mention the chemotherapy that saved Jimmy Carter's life.
Not chemo, immuno.
Immunotherapy,
Yeah.
but also wasn't part of that you were talking about the blood-brain barrier, that they actually introduced it into the cerebral spinal fluid to save him?
Nope, that drug crosses the blood-brain barrier.
That one does, automatically. Okay.
Yeah, automatically. Okay, well now, so that got through that. I sent you and I sent Ray, and see if I can pop it up on here quickly, the medical news of the day here. I sent it to Ray on Thursday morning, and I pulled it up for you just a few minutes ago because this is this morning. Now, what was in the one I sent to Ray 3 days ago is gone now. But when you start
Thank goodness.
Thank goodness. But anyway, when you start looking at the latest health news, there's not a single thing about COVID on the first half of page until you get to this one about the mask. The mask mandate I was telling you earlier is going to be extended for aviation from March 18th to April 18th, quote, so the World Health Organization and the CDC can come up with a good process to relax it. Well, I think the good process to relax it is to relax it. So anyhow, maybe
you
there's
didn't get to see it, but I sent you an article from, or actually it was a post from 2008 looking at the air quality in aircraft. At that time, COVID didn't exist, and the infectious disease killer over millennia is tuberculosis.
Now remember, I was the medical director at Delta when we had tuberculosis on the plane.
You had a case. Yeah.
Well, we
and
had
actually,
an
I think they
epidemic
mentioned
of
that in this article where they actually traced how many seats forward and how many seats
Well,
back.
I published that in 2008.
Well, I just sent you the CDC post back from 2008, so we're doing a circle here. Interestingly,
That's our case.
it's cool. It's cool history here. So that in that study, looking at air exchanges, an aircraft changes the entire air content of the aircraft 3 times a minute. 3 times a minute, and it runs it through HEPA filters. And so this nonsense of thinking that a mask slopping around on your face is superior to that air exchange and air filtering that's going on in aircraft is shit.
Now let's go back here.
Oh, I heard
Okay,
that.
cough. That was a cough.
Okay, prior to this generation of aircraft,
Yeah.
they exchanged the air for outside air,
Yeah.
and now they
partial. They recirculate, but they also bring in new air.
Correct, but
Yeah.
previously it wasn't recirculation.
Yeah,
It was
stale air.
It was replace it. Just replace it every minute, or
Yeah.
I think it was every minute or minute and a half. Well, that allowed stuff to circulate around for a minute and a half, and then they started coming up with these HEPA filters and all the rest of that stuff. That's about the time you got the engineer out of the cockpit and got into airplanes that didn't have to have a third guy in the back with a sextant, figuring
Yeah.
out. So anyway, that's a great story there. I wanted to hit 2 things. How many COVID cases have there been in Fannin County this week?
I don't know.
Anecdotally, I don't know, but I will tell you I've not had one call.
Okay, great.
Not
But
one call all
basically,
week.
there have been -3. There have been
They're digging them up or
There have
what?
been no new cases, 0 new cases, and they removed 3 from the list because they didn't meet the criteria of really being COVID. Now there've been no deaths, so usually the deaths are lagging the cases. So there have been 0 cases, 0 deaths, and they actually took 3 cases out of the list. Okay, now the second number we got to talk about is what's the positive number yesterday for the test done to the surveillance test. It's 3.1%. And remember, it was 20% a few weeks ago. We've always said when it gets below 5%, quit talking about it, go on with your life. And that's been a year ago that we said if it gets below 5%, and it did. So it's down, it's going to stay down, get the mask off. Well, New York says they took the mask off so you can go into a restaurant. I think people are pretty much bored with that sort of thing, right?
They're done with it.
They're done with it. All right, so we're going to keep going through this list here, and now they got two things that interested me. One, facial recognition. You can open your new cell phone. I bet he's got a cell phone with facial recognition.
That's what it does.
Well, as of your update that's going to come to you tomorrow night, it'll now be able to recognize your face if you're wearing a face mask. If you're
Just in time.
Just in time to take it off. I thought that was good. And now this one here is for.
Hey, Bill, you know how you're going to have a bad day
No.
when your facial recognition doesn't recognize you anymore. You're going to have a
Did you
bad
just
day.
write that? Is that
All
new
right.
material?
It hit me. I couldn't get
New
it to
material.
open. I couldn't get it to open one day, and I said, "This is not going to be a good."
Right on
day."
the spot, writing new
All right.
material.
Okay, everybody in the green room listening.
What?
Green room listening to this one here.
All ears.
Just one extra drink a day may change the brain. So what they're trying to do is they're trying to make this 2 drinks a day that we're taking not healthy anymore. These 2 boys here don't drink at all. And they're telling you got to cut it down 50%. And I'm just
Does it
hoping.
say anything like pickle the brain? Does
No,
it-
I just hope
does
that I hope Dr. Tidman can go through this article and show us it's fake news like he did with
I
the
will.
other
I'll
one.
have to go through that. All right, listen. Let me digress
All
about
right.
this head trauma patient since it's interesting that you've talked about that today, and I had a very interesting case today, and you've not heard this story.
All right.
Unrestrained passenger in a semi truck in the sleeper, wife of the driver.
Hopefully.
No, well, these are my patients. This is a couple. Texas, middle of the night, 2 a.m., 2-lane highway, 70 miles an hour down the road, lights coming right at him. He keeps looking at it like, that guy's in my lane, that guy's in my lane. Boom. That's 140 mile an hour
Wow.
head on.
like
I
I-
have a quick question. When do you realize they're in your lane? And I say that seriously because
By
if
2
you're-
o'clock in the morning, you're having trouble realizing anything.
Well,
But you're
seriously, if
focusing.
you're coming like this, it's
It's too late.
people wonder how did you hit somebody head on, but for a period of time, you can't
No, you
determine
can't.
100% if they're
No,
in
you
your
can't.
lane.
You can't. And he couldn't. There's nothing he could
Right.
do.
Well, he hinted at something I need to pull out as being wrong. He said at 2 o'clock in the morning you're not focused on anything. If he is a certified truck
No,
driver,
he is.
he was fresh.
I'm talking about me, not him.
Okay, yeah. He
No,
was,
go
he
ahead,
was fresh.
go ahead.
Go ahead.
So what he can't
70
get out of
mile
his
an hour.
head is the body coming through the windshield, clutching his bottle of beer. But what we're dealing with is her. Mm-hmm. And she really got her noodle rattled. Okay. And she's now in one of the big head trauma centers in Atlanta, which has several expertise level care folks
That's
whose
going to be
heads-
Shepherd.
Yeah. And I was visiting her for the first time in probably 2 weeks since my first visit, and she's slowly improving. But one of the things that we ask during our mental status exam is, are they having any other symptoms? And I'll jump right to it. Are you hallucinating? Are you hearing things, seeing things, da-da-da? Because that's a special level of injury. Well, she is. She is seeing and having a voice speak to her, a person. And so the husband's distressed about this because it upsets her. It only goes on for less than a minute, and he can talk her out of it, or she can get up and walk away from it. So my question as a physician is, should I be medicating her? Well, her brain's already pretty scrambled, so I don't want to put anything in there that's going to dumb her down. So it's a very difficult decision to make. And I'm trying to figure out, okay, well, what is this that's going on? Is it stressful? Is it a nightmare? Is it something that's agitating her? So I need to ask more questions. And I'm going to get over into the spiritual side of things now. This person is named. This person has the body and dress of the driver and has no face. And is asking her to forgive him. I shouldn't have done that. I'm sorry. I shouldn't have done it. Keeps coming at her. I'm sorry. And she's trying to say, go away. I can't handle this. And I asked her husband, I said, did she see his face? Because they pulled the body. He's dead, but he's laying on the side of the road. And she did not see his face. She just saw his body. So is this an hallucination or is this something else?
That's a good question.
Wow. Now she's still in a center in.
No, she's at home.
She's at home now?
Working through life. She goes in and out and has tests, and they're doing what they can do. And time will tell.
You know what they can do? Nothing except tincture of time and occupational training to try and bring back familiar things, have familiar pictures and stuff like that.
What are some of the neurological whatever
she's having
some of the brain scans?
Well, she has no one injury. So I mean, basically, you shake the
but
your head like
no
that.
paralysis and no seizures.
Right. She's had seizures and she's on Keppra.
Okay, we call this billiard ball trauma. I want you to listen to this just because it's really important. The skull, you imagine an egg inside a rigid structure in some water, but you're shaking it so hard because that brain goes back and forth and it hits backward, it hits here, that little egg going back and forth. If it's strong enough, you might crack it. But if you don't, you can just imagine the stuff on the inside's been chewed all up. That's what happens in a brain concussion.
And in this kind of injury, she had her brain somewhat scrambled. But your question is good. So her symptoms, observing symptoms, besides this emotional events that's happening occasionally, is that her speech is slurred, it's not as clear, and her gait is ataxic. She's not able. She falls easily. She has to keep her hands on something. So she's got some real cerebellar injuries, and she's got some left brain language injuries that are specific, and then she's got this global confusion going on. So
she probably still has headaches, and she's probably still has.
But the seizures are controlled now with the.
She had difficulty, tying her shoelace. Or
that's a good point. Her handwriting is different.
Yeah. Anyway, that's that.
Well, that story, I have to tell you, that's. I hope her and the husband all the best as they're working through this, because that was quite a traumatic situation. I can't imagine hitting somebody 70-mile-an-hour head on, and then what she saw and getting.
It's interesting because this is some interesting neurology. As we are in that adrenergic state, our whole body centers down, and your visual cortex fires up. So you're hypervigilant. It's almost like going into a high-speed camera. And if you've been in an accident, almost everybody can attest to this. You remember that accident, and it's almost like it's slow motion. It plays before you. I was in an accident. I could see that metal crunching coming forward in slow motion, and it was years before that image left me. He in slow motion sees this guy coming through the windshield past the front of his truck as the two vehicles melded. And I've said, it may be a year or two before you stop.
You may not ever get rid of that. He's got PTSD. I mean, just imagine that this was a combat injury or something, and he was in the VA.
Yeah.
He needs help too, even though he's got a brain injury.
Even though he's not as injured as her, he does not.
All right, so that's good.
Okay, so
donate blood.
Donate blood.
Oh, wait, one more thing.
What you got?
One more thing on here.
We gotta get you to work.
Remember Zika?
Oh yeah, I remember Zika.
Read that one.
What is it? Mosquitoes may be released.
Genetically modified mosquitoes.
How could that go wrong?
Florida and genetically modified mosquitoes may be released in Florida and California. Why?
because they can't reproduce. So the sexual ones go down there and they can't reproduce, and then the mosquito population goes down, and then equine fever and Zika. So that's your Zika update 3 years after the Zika
I can't
update.
see anything going on wrong with that, can you?
No, nothing. Do you have anything to close? Or
No, I
you
don't.
out? Okay.
Well, grandchild joke.
You got a grant? Go ahead.
What did the fish say when it ran into the concrete wall?
I don't know.
Damn.
Okay. All right, folks, that's it. We have our all-star political panel waiting over here. Thank you, Georgia Cancer Specialist, Northside Hospital Cancer Institute, for this segment, and we'll be right back after these messages.